the most vital issues in our community, and that is our healthcare services. We want to ensure that our community-based hospitals continue to serve our most vulnerable population, our seniors, our individuals with disabilities, our working class families, and Seton has for a very long time been that institution here in Daly City and in San Mateo.
It has been a year since Daughters of Charity struck a deal with Blue Mountain Capital Management, a New York hedge fund. How has our community fared over those past year under Blue Mountain's control? What has been the impact on patient care and caregivers? What steps can the community take to ensure quality care for patients as we move forward? A healthy Seton is a vibrant Seton.
As noted earlier, it has been almost a year since the Attorney General approved the transaction between Daughters of Charity Health System and Blue Mountain Capital Management, which is a hedge fund based in New York.
I'm very concerned about the idea of a New York-based hedge fund taking over Seton Medical Center, our community hospital, which has been so important for decades.
So hedge funds, they aim to provide the highest investment returns possible as quickly as possible using very risky strategies. And they operate with little regulations. They're secretive, they're privately owned, privately managed with private investors.
What's playing out here at Seton Hospital, exemplifying, everything that's wrong in our healthcare system nationally, where our hospitals and many aspects of our healthcare system are run by corporate entities.
When Blue Mountain agreed to this deal, it also agreed to the conditions imposed by the Attorney General. And Blue Mountain has a duty and responsibility to adhere to these conditions and to keep the hospitals up and running for at least 10 years to maintain certain service lines and to also meet spending targets on charity care, among other conditions. But we need to hold them accountable to meeting those conditions.
Seton is extremely understaffed. Currently, with a technologist is sick or on vacation, our patients have to reschedule their appointments because there is not another technologist to do the job. How awful is it to be told, sorry, we have to reschedule you. The next available appointment will be in 2 months.
It is important for us to retain staff that have been loyal and committed to the hospital and its patients over the years. Many patients rely on the hospital for their care, and by reducing services, they will be forced to seek care elsewhere.
They've got us watching up to 52 patients, one tech, eliminating 3 monitor tech positions. And we used to watch 28 to 29, so it's really put a lot of pressure. The communication system is very, very weak. There's times when I can't get information to an attending nurse, which, seconds could make a difference of life or death. Patient care and safety is at risk, and it's something that we really need to address immediately.
There's been a quality of care for over decades, and we need to continue that legacy and tradition that Seton Hospital has done for all of our families and our seniors.
It is a beacon of light in our community, and I look forward to driving on the highway and seeing it there every day.
I would like to see Seton become one of the best hospital in the area.
And we don't want to leave. We want to stay, and we want to help our patient and our community.
This is an institution that allows us to thrive and allows us to live in many cases. And so we have to make sure that institutions such as this are under utmost accountability and transparency.
When the Attorney General approved the hospital, there were expectations that were supposed to be met. I believe those expectations are not being met.
I heard very loudly and clearly that Vice Mayor Canepa and I should be reaching out to our Attorney General to convene a community hearing on this really important institution and how we are going to ensure the delivery of the best healthcare services here in Daly City.
We always expect accountability. We always expect transparency. And Blue Mountain owes us that piece. And if they are not able to live up to the agreement that they have, then they should be held accountable for that. Patient care should come first.
But there's really no place for profit in a service like healthcare or public education. saved should go directly back in the classroom, directly back to healthcare services, and directly back to patients that can't afford care. As David mentioned, charity care is incredibly important, and we depend upon our nonprofit and for-profit institutions in providing that, not because it's about their bottom line, because it is the right thing to do. And healthcare is one of those industries that we've got to make sure that we hold their feet to the fire to take care of all of us.
We're here at this town hall because we really want our workers to have a quality contract, but we also want our community to have a quality hospital to come to. I want the hedge fund to know we want our hospital to succeed. We want to be here. We don't want that to close. We don't want to be a piece of real estate on the hill.
Provide us with a safe environment and healthy environment to do our job.